There is a penalty built into Medicare that most people don't find out about until it's already too late. It doesn't show up as a warning. Nobody sends you a letter before it happens. You miss a window, and then you pay for it. Permanently. I'm Val. And today we are talking about the Medicare late enrollment penalty, what it is, how it works, and exactly how to avoid it. When you turn 65, Medicare gives you a window to sign up. That window is called your Initial Enrollment Period. It is 7 months long. It starts 3 months before the month you turn 65, includes your birthday month, and ends 3 months after. If your birthday falls on the first of the month, that window shifts 1 month earlier. So pay attention to that if your birthday is on the 1st. 7 months sounds like plenty of time. And it is, if you know it exists. Let's talk about the penalty that catches the most people off guard. Part B. Part B is your medical insurance, doctor visits, outpatient care, lab work. It is not automatic for everyone. You have to sign up. If you don't sign up for Part B during your initial enrollment period, and you don't qualify for an exception, the penalty kicks in. Here is how it works. For every full 12 months that you could have had Part B but didn't sign up, your monthly premium goes up 10%, and that increase doesn't go away. It stays with you for as long as you have Part B, not for a year, not for a few years. For the rest of your time on Medicare. That is the part nobody warns you about. The Medicare Handbook gives us a real example. A man whose initial enrollment period ended in December 2021. He waited until March 2024 to sign up. That was 2 full 12-month periods where he could have had Part B but didn't. His penalty, 20%, added to his standard premium every single month for as long as he has Medicare. The standard Part B premium in 2026 is $202.90. A 20% penalty means paying more than that every month forever for missing a window. Now, there is an important exception, and I want to be clear about it because it applies to a lot of people. If you are still working when you turn 65 and you have health insurance through your current employer, you may qualify for a special enrollment period. This means you can delay Part B without a penalty, as long as that employer coverage stays in place. When your employment ends or your employer coverage ends, you get an 8-month window to sign up for Part B without a penalty. But here is the key word: current employer, not a former employer, not retiree coverage. Current employment with active coverage. If you are in this situation, do not assume you are covered. Contact Medicare before you decide to delay. Confirm that your coverage qualifies. Get it in writing if you can. Part D is your prescription drug coverage, and it has its own penalty with its own tripwire. If you go 63 days or more in a row without Medicare drug coverage or without other creditable prescription drug coverage, you may pay a late enrollment penalty. Creditable coverage means coverage that's at least as good as Medicare's standard drug benefit. Your employer plan, TRICARE, or VA drug coverage may qualify. Your plan or employer is required to tell you each year whether your coverage is creditable. Keep that notice. Like the Part B penalty, the Part D penalty is permanent. It gets added to your monthly drug premium for as long as you have coverage. Here is what people miss. Even if you don't take prescription drugs right now, you should seriously consider joining a Part D plan when you're first eligible. A penalty that builds up over years of not having coverage can easily cost more than a low premium plan you rarely use. Part A. Hospital insurance has a penalty too, but it affects fewer people. Most people get Part A with no premium if they or their spouse worked and paid Medicare taxes for at least 10 years. If you worked a full career, you almost certainly qualify for no premium Part A. If you have to buy Part A and you miss your window, your premium can go up 10% for twice the number of years you delayed. But for most people, Part A has no premium. The penalties to watch for are Part B and Part D. So how do you avoid all of this? 3 things. 1. Know your initial enrollment period. Mark the calendar. It starts 3 months before your 65th birthday. Don't wait until your birthday to start thinking about it. 2. If you are still working and have employer coverage, confirm with Medicare that your situation qualifies before you decide to delay. Don't assume. 3. If you have prescription drug coverage through another source, verify that it is creditable coverage. Your plan is required to tell you. Keep that documentation somewhere you can find it. If you are unsure about any of this, please don't guess. Visit Medicare.gov or call 1-800-MEDICARE. That's 1-800-633-4227. There is also a program called SHIP, the State Health Insurance Assistance Program. It's federally funded and it provides no-cost, one-on-one Medicare counseling. No sales pitch, no agenda. Just someone who knows Medicare and can help you work through your specific situation. You can find your local SHIP at shiphelp.org. I can explain how the penalty works, but I can't calculate your specific penalty for you. For your individual numbers, please reach out to one of these resources. They are there to help. In the next video, we are going to tackle the comparison that trips up more people than any other Medicare decision. Original Medicare versus Medicare Advantage. I'll walk you through what each one actually means, what the real trade-offs are, and how to think through that choice for your life. If this helped today, subscribe. Every week, one more piece of this puzzle gets a little clearer. I'm Val. Medicare doesn't have to feel like homework. Let's figure this out together.